The purpose of this video is to review med administration for some of our medications that we give for hyperkalemia, as well as how to differentiate some of the syringes and needles that we'll use. So one of the things that I want to talk to you about first is giving medications IV push. Now I'm going to show you how to do that and talk to you about doing IV push, but as a nursing student, you still cannot do that in the hospital, and that's Florida law that regulates that. So when you give something IV push, there's some important things that you have to remember. One is that you should always use the saline flush before and after administering the medication, and you want to make sure that the IV site has a good blood return. You need to also always with IV push medications, you need to make sure that you know how fast you can give the medication, what the rate is, how fast or how slow. You want to make sure to know if it needs to be diluted or not diluted. If it's diluted, you need to make sure that you know what solutions are compatible. And if you, or just as an aside, Institute for Safe Medication practices says that as nurses we are over diluting medications, so it's important for you to find out before you administer. Good morning, sir. Can you tell me your name and date of birth? All right, thank you. Okay, I'm going to be getting your medications ready. All right, so we're going to get the medications together that we're going to give. So I want to show you a few things. So one of the medications is calcium gluconate. So I've got your calcium gluconate, and the doctor has ordered 10 mLs of 10%. One of the things, so it's 10 mL, so I want to make sure that I get a 10 mL syringe, and I want to, in this case, because it's a big vial, I want to use a blunt tip needle. Put on my gloves. Now, our blunt tip needles at HCC Hospital are the ones with a green stripe. So I'm going to clean my top. I have a 10 mL syringe. Now, that's my blunt tip needle. Remember, when you're drawing from a vial, you always want to inject air first. So you're going to inject 10 mLs of air, because that's how much I want to draw back, and then I'm going to draw out my 10 mLs. Also, when you're handling the syringe, you only want to handle the end of the plunger. You don't want your hands all over the inside of that. All right, so that is 10 mLs of calcium chloride. I'm going to scoop up my cap, and I'm going to leave the cap on in this case. I'm going to mark that so that when I get to the bedside, I know that that's what I've got. So that's my calcium chloride. Patient also has ordered a dextrose 50%. That comes in its own pre-filled syringe. And basically, depends on, this is an old package because it's thin. You would pop off the caps, and what you want to do is build your own syringe. So you just basically attach the plunger to the syringe, to the barrel. Doctor has also ordered 10 units of regular insulin. So I've got regular insulin. All right, the thing about drawing up insulin is insulin is in units. It can only be with a unit syringe. Usually we use this syringe. The thing about this syringe is the needle is attached. So you have to have a syringe that's unit-based that does not have a needle attached. And so we have one of these here for us. So I'm going to attach a needle to this. I'm going to draw up my insulin. because it's insulin, I want to validate that with my colleague. In this case, I'm going to close my safety device so that I can set this down. You never want to set down a syringe with a open end. Label my insulin. The last one is Lasix. Alright, so the doctor ordered 40 milligrams of furosemide. And in this case, I have 2 vials, or each vial has 20 milligrams in it, 10 milligrams per ml. So I'm going to draw up 4 mLs based on my calculation. Draw up 4 mLs. Now in this case, I'm going to use another of the blunt tip needles because it makes drawing up a lot easier. Just beware, don't use this type of needle in the insulin syringe, in the insulin dosing, because it's a multi-use vial and it would create too large of a hole. So what I know about the furosemide is that I can give this at 10 milligrams, at a rate of 10 milligrams per 30 seconds. Alright, and so my furosemide is drawn up. Alright, this medication that I'm going to show you is drawing out from an ampule. And the reason I'm showing you this isn't related to our hyperkalemia patient. But just as a reminder, I know you learned it in first semester. First of all, this is a glass ampule. You want to break it using an ampule breaker, or you can wrap an alcohol wipe around, hold tight, hold the bottom tight, and then you push it away from you. And you would put that in a sharps container. This is the time that you need to have a filter needle. So I have a filter needle here, because I want to filter out any glass sharps. Now I'm going to say that I need 1 ml from this ampule. This is the thing that students have the most trouble with. You can turn it upside down, and you want to turn it upside down because of how you use ampules in the field. And so you want to draw out your 1 ml. Let me release my pressure with my syringe. Draw out your 1 ml. Do not inject air into it. That's the thing that will break the seal. Alright, and I'm going to demonstrate how we would give one of the medications IV push. Alright, can you tell me your name and date of birth, please? Oh, okay. Now I'm going to put my IV on hold so that I can flush it. I'm going to give the medication in the port closest to the patient. I'm going to start with a flush. This is a peripheral IV, so I only need to flush with about 3 mLs of solution. Okay, and I'm going to go ahead and give the furosemide. Now furosemide I give at 10 milligrams for every 30 seconds, and I have 4 mLs in my syringe. So I'm going to give it, look at my watch, wait about 30 seconds, give the next ml. I'm not going to take the whole 2 minutes, but it should take 2 minutes to give. Disconnect, and then I'm going to flush. Alright, and that is that.